But that's really the only time you should speak louder. Try not to interrupt them when they're trying to communicate. A question I get from caregivers often are, should we test my loved one? Because will it help them regain words? Will it help them get their language back? Unfortunately, we don't believe it will. So like, for instance, if you're going down the street with your loved one and you see a fire hydrant and you're like, oh, what's the name of that? Because you want them to regain their language, we don't think that that's going to help them. And unfortunately, I think it will do the opposite. It will just feel like they're being tested, they'll get frustrated, they might not find the word. So what we go over in speech and language therapy is ways for the individual to communicate when they do and when they do not want help. So it could be as simple as the individual might say, if I go like this, that means I don't want help, I need some more time to try to communicate what I want to say. If I go like this, that means help me. And so anytime the individual wants help in their communication, wants you to provide a word, wants you to cue them, anything like that, we suggest doing that. And then face-to-face communication is really important. Nowadays everyone's rushed and it's really easy to try to communicate when you're in two separate rooms or when you're multitasking. So this seems like the best situation if someone has a difficulty with communication, you want to be face-to-face seeing each other. So if you live in different states, it's really helpful to use something like Skype because again, facial expressions, gestures communicate a lot. And then don't have different distractions. If you are in the same place as your loved one, then just sit face-to-face and practice the strategies in the speech and language therapy that you're supposed to practice face-to-face, communicating with each other in a patient way. And if you're stressed out, that's probably not the best time to practice. If you have a lot of things on your mind, you're multitasking, not a good time to practice. So these are obvious but important things to make sure you're doing when you're communicating with someone who has difficulty with speech and language. Supporting comprehension. It's important to use short and simple sentences rather than multi-step sentences. So if you're giving instructions to your loved one like, can you put the glass in the sink and then go sit down? It's better to say, can you put the glass in the sink? Wait for them to put the glass in the sink and then say, oh, can you sit down at the table? Because especially for people who have auditory verbal working memory, such as the logopenic subtype, they're not going to be able to keep all that information in their head and then they may forget it. So use short, simple sentences. Even people with difficulties in grammar, this will be helpful for. Reduce your rate of speech. Don't talk too quickly. Stating the topic in the conversation is really helpful. So for instance, before you have a conversation with your loved one, you can say, I'm going to be talking about the family trip we just took, and then talk about the family trip. And that way it gives them more context and more ability to understand the conversation. Rephrasing and reviewing messages can be really helpful. If they don't understand it the first way you explain, then maybe rephrasing the way you said it can be helpful. Maybe they'll understand it better that way. Reviewing messages that they say to make sure that you're understanding what they're saying is also really important. And then be honest, ask for clarification when you're not understanding. Don't pretend like you're understanding when you're not. And then now I'll talk about cognitive rehab therapy. So this is trying to support memory and executive functioning. Creating a structured routine and schedule is really important. If someone has difficulty with memory, it's best not to rely on that memory. It's kind of like not trying to test their language. You don't really want to test their memory. So if they're doing a similar thing, every Monday, Wednesday, Friday, or every day, then you're not relying on their memory as much, and they can better function because they know what to. They're more likely to know what they're supposed to be doing because they're doing it on a daily basis. So a speech language pathologist can help develop that routine or schedule with the caregiver. Use of memory aids is really important. Again, not relying on their memory. So things like planners, calendars, whiteboards with, saying what their tasks for the day are or what their schedule is. Those are important. Technology for reminders. All those things are helpful. A speech-language pathologist can help prioritize a to-do list that the patient has or the caregiver has, breaking down tasks. It's really helpful to break down tasks into smaller parts, especially, for instance, if someone is apathetic or they have difficulty with executive functioning. If you break the task into smaller steps, it's less overwhelming and they may have a better chance of actually getting that project done if it's broken down. Addressing components of memory is really important, being attention, encoding, storage, and retrieval. So most people don't realize, or maybe a lot of people don't realize, that if you don't pay attention to something, you're never going to remember it. So for instance, if you park your car in a parking lot and you never attend to where you parked it, there's no way you're going to remember where you parked it because you never paid attention in the first place. So going over the different components of memory can sometimes be helpful because it can make you attend to things more often. And reducing internal and external distractions can help with attention. For instance, external distractions being noises, smells, things that you see. Identifying those distractions and eliminating them can help with memory. And internal distractions being, stress, fatigue, things like that. So when you can identify that you're stressed or tired, then you'll know that you're not going to be as good at remembering things or attending to them. A lot of the therapy revolves around supporting the caregiver. There's a lot of information that you get from clinicians and physicians and everyone, and I know I can't even imagine, but there's a lot on your plate. So what we do is we first educate the caregiver more about the diagnosis, so you know what to expect, you know what symptoms to look for, you know how to track it better, you know how to not be surprised when maybe they develop a new symptom. We do our best we can so you are more educated about the diagnosis. We also go over how some strategies to share with your friends and family about the diagnosis. We make sure that the goals are shared between the patient and the caregiver. For instance, maybe there are behavioral disturbances that your loved one is doing. For instance, some stereotyped behavior or disinhibited behavior that they're doing. And then we can help think of ways and plans to reduce those symptoms or those behaviors that aren't ideal to be happening. And there's something called the DICE approach, which stands for Describe, Investigate, Create, and Evaluate, that helps think of plans to reduce these behaviors that are hard for the caregiver. So for instance, there was a patient that we knew that lived in assisted living, and she had a routine schedule, and she did everything. Every day she was totally fine. She loved art. She went to lunch at the right time. And then all of a sudden she was trying to go out of the assisted living facility, was wandering all around, just seemed really anxious and frustrated and stressed out. So we tried using the DICE approach, and then the health professionals and the caregiver described the situation. Then she investigated what about the situation is different than her normal day-to-day life. And then when they investigated, they found that her watch battery stopped. And she had a diagnosis of semantic PPA, and so she was having some behavioral changes, and she was really fixated on time. And it worked for her most of the time because she would just show up. She was very on time to everything, but it worked for her. But then her battery stopped. So we created a plan to prevent this from happening. For instance, every few months we make sure that the clock is working, and and then evaluate if that, after you create a plan, then you evaluate if that plan is actually helping and working. And if it's not, then you manipulate the plan that you created. And then creating a safe environment is really important. People with these different types of diagnosis, it's often helpful to get a bracelet with the diagnosis, and then contact information if anything bad, if they wander or something happens where, like, a stranger doesn't know what's happening or they're not communicating well. So, something worse doesn't happen, people can get arrested. Even if they're cognitively normal and they're having difficulties with language, a stranger might not know what's going on if they're not communicating well. So it's important to have these bracelets if you think that's a good idea as well, just so you can be contacted if anything does come up. Also, sometimes people use video cameras. A lot of people, their loved ones can be in the house by themselves for a long period of time, but just to make you feel more safe, you can see what your loved one is doing, making sure that they are safe in their house. Also, completely up to you if that's something that you feel like is appropriate. And there are different types of ways that we suggest to make sure that it's a safe environment for the patient as well as the caregiver. Reducing caregiver burden is really important. There's a lot that you have to take care of, and if you're not taking care of yourself well, then it's probably very difficult to take care of someone else well. So it's important that we figure out a way for you to have time on your own to focus on how to make yourself happier and healthier, so that you can help your loved one better. Some community resources. It's important that you have an interdisciplinary team of health professionals near you. We are more than happy to help you get a diagnosis, and we can work with you if you are local. But if you're not, then we can help you find health professionals that can help you near you, so you don't have to drive hours and travel hours away to get help. Adult day health programs can be really helpful. They create structure and routine for individuals. They provide socialization. They provide meaning and activities. And oftentimes individuals don't want to go to the adult day health programs, but we find sometimes a good approach to that is saying, maybe you can volunteer at the adult day health program and help everyone else with the activities they're doing. Even though they are a participant in the adult day health program, sometimes that at least gets them into the door, and usually once they experience the adult day health program, they usually enjoy it. Residential programs are helpful to think about in the more severe stages of the disease. We can work with you to let you know of ones that we have referred patients to with these diagnoses. Companions are really helpful because they can help individuals do the hobbies sometimes that they used to do, but maybe they can't do the hobbies because they don't drive anymore, or because it involves some type of communication that the companions can help with. So that can help also the caregivers have more time for themselves if the companions can help them do the things that they want to do. Home health aides can be helpful too, especially in the more severe stages of the disease, because caregivers are really good at providing love and support and knowing their loved one really well. So if there are other people who can take away some of the other tasks, such as helping with eating or toileting and things like that, then you'll have more time to love your loved one and do the things that only you as a caregiver can do and that other people can't. And that's it. So if you have any questions,